Hi, I'm Rachel Pope. I'm a gynecologist at University Hospitals in the Urology Institute.
My name is Jared Dalton. I'm the director of the Center for Populations Health Research at Cleveland Clinic.
My name is Vanessa Ho, and I am a surgeon at Metro Health.
I'm Johnny Rose. I'm a preventive medicine and public health physician and an epidemiologist, health services researcher at Case Western Reserve University.
I'm Adonis Hijaz. I'm the Vice Chair of Research and Academic at University Hospital Urology Institute.
My name is Tyagarajan Subramanian. My short name is Sub. I am at the University of Toledo College of Medicine and Life Sciences in Toledo, Ohio. I'm a professor of neurology.
My area of research is currently focused on implementation science and the field of urinary incontinence.
My research is pretty wide-ranging, but it involves the use of integrated data to study problems in population health disparities.
I work on Parkinson's disease and related disorders and do research both in the bench as well as see patients and do clinical research with patients with Parkinson's disease.
My research focus looks at the recovery trajectory of individuals who have had an emergency surgical catastrophe.
Most of the research I do is cancer-related, although I do work some in the area of transplant. I mostly do computer simulations of sort of complex population health problems.
So my focus is on understudied vulvovaginal disorders for women and also transgender populations.
The Atlas program, for me, has been really interesting because I think of myself as I'm mid-career, but I'm still early in research leadership. So to come in and be a part of a program like this, sitting side by side with people I really respect, who are, some are mentors to me already and some are people I've never met before, it's been an honor.
I can say I'm a beneficiary of the team science approach. My research has benefited from that strategy on my daily life. However, learning more of the approaches, learning more of the science behind it, about how we manage a team and how we be effective team leaders is critical for our success and my success personally.
It's been a real true introduction to the CTSC, and I've also gotten to meet some wonderful colleagues as part of my team.
We had amazing interactive sessions with experts in
Storytelling, and we did a very in-depth evaluation, introspection of positive aspects of our working behaviors, and all of these things have really gotten us thinking.
The quality of the speakers has been outstanding. I didn't expect to be able to hang on to every word of a speaker speaking for 3 hours, but that was accomplished twice yesterday. So
I was very surprised by our session yesterday with the storyteller, but I realized how important it is to think about leadership in a different way, get some new tools, because we don't learn a lot of these techniques in medical school, unfortunately. And so far it's been a really great way to kind of challenge us and give us some new techniques, and then also to help us think through how we can collaborate better within our systems and also with the other institutions in the city.
I wasn't sure what to expect when I came to the Atlas program. And the first session that we had was about storytelling, which hasn't ever been a focus in my life before. And I found it both enthralling and inspiring to think about ways that I could reframe my research, but also the relationships in my life to be more around the stories and what they can teach us. And I love that. I love that we are learning these skills that are transferable not only to our research, but our lives.
I think it's wonderful that we're given the opportunity to think and be very intentional about the types of skills that we have and that we need to build for leadership. And particularly, I found the storytelling session to be extremely valuable as a way to communicate in both our personal lives and in our research.
And I think it really is key as a mid-career scientist and emerging leader to be able to have a broader perspective on who you are as a person and translate that into your work.
So the overall theme for the team project is to improve on the education for team science approach.
My team is challenged with improving research dissemination and integration of findings to improve health equity in the community.
So our team project is to increase minority representation in clinical research.
We try to understand the scope of the project and how we can approach it. And each one of us is taking a task to reflect maybe on the project, and each one of us will come up with their own ideas, and we will reconvene so that we can develop a unified approach, and hopefully we'll be successful.
It's really interesting to come together with a group of people who have such disparate backgrounds and work together on a project.
To see the different ways that we sort of walk around this problem or just jump right into the middle of it. So that's been a good learning experience in itself.
Overall, I think the Atlas program is really well put together. So I think I'll get some leadership skills. I'll be able to lead teams that can actually bring Northern Ohio institutions together all the way from Toledo to Cleveland.
Right now, I usually do pretty small studies in general, and they all come from my own research questions or my own clinical questions. So I want to be able to have a broader scope, be able to look at a larger component of healthcare and really learn how to lead an entire team.
I think what I didn't know I was going to get out of the Atlas program were these skills for life that I can work on even outside of these rooms. Skills for team building, for leading, for sharing my stories. I wasn't expecting to come out of it with that, but now I'm really excited to develop those skills.
I hope to get insight into my own personal strengths and weaknesses and strategies for how to overcome some of the latter when it comes to leading teams.
What I really hope to get out of the Atlas program overall is to have tools and strategies for better connecting with people. And I don't mean just people that might formally report to me in an organization or might be a fellow team member, but I mean people in general. I'm looking for a way to really embed the things that I'm learning into myself as a person, and then allow that to be reflected in the various roles that I have, whether it's as a manager, director, a research collaborator, as a spouse, or as a parent. So, and I think the things that we've been discussing they really help you dive deep into who you are and how you can better connect to people. And that's what I ultimately find value about this.